First of all, they should be sure that their problem arose not from a medical reason and not from poor practices. We've said we want you to be having sex 3 times a week. The purpose of the 3 times a week is that by all means you shall be able to meet the ovulation time. You must remember that once the ovulation occurs, within 24 hours the egg is gone. So if you haven't had sex before that time or by that time, then the likelihood of the sperm meeting the egg is very small. If you have sex, we are assuming that you are ejaculating into the vagina. Because if you are ejaculating outside the vagina, the sperm is not going to meet the egg, you're not going to get pregnant. You understand? So all these are factors that they need to ensure that they have adequately covered. So if they are doing that and they are not getting pregnant, then we would suggest that we like to see them as soon as possible. For a couple that is fairly young, we say try for a year. If you don't succeed, see a health professional. And we would say see a health professional early. For a couple that is older, so if you're like, let's say about 35, or usually we say 40, I even like to bring it down to about 35. We'd say after 6 months, if you've been trying and not getting pregnant, see a health professional, because the chance, the window of treatment is smaller for those who are older, because age is one of our biggest enemies in getting pregnant. So don't think that it is, maybe I'm waiting small, before you are aware you've gotten to a worse situation. And that extends to where, and I like to say a word about those who are doing IVF. We tend to think that IVF, it's not your time. It's not your time. Your eggs depreciate with age. The quality and number depreciate with age. Sperm too, the same thing. Not as fast and as hard as women, and not at the same age, but for women, 35 going, it becomes more challenging. And for the men, it's a bit significantly older before it becomes more challenging with sperm. But the idea is that if you need an IVF and you do it when you are young, under 30, your chance of getting a pregnancy is very high. That same woman doing it 10 years later is going to have the chances go down significantly, and after 40, the chances are pretty low. So taking an early and prompt action is really beneficial. But if you've tried, you're not getting pregnant, and you've spent 6 months to a year and you haven't succeeded, I would say seek for help.